Let me know you're out. So, hi everyone. Thank you very much. For anyone who has not been here before, my name is Jo Southall. I'm an independent occupational therapist. I also live with hypermobile, EDS, POTS, and a load of random other stuff as well. So, I'm here this evening to answer any and all questions on your, hypermobility needs. So, please do feel free to pop some questions in the chat, and I will answer them as quickly as I can. You've got one up already. Will the recording be public or just for HMSA members? I think it's in the members section of the website, isn't it? Link Fairy will let me know, I think. I'll pass that over. Yeah, Link Fairy, if you wouldn't mind replying to Jenny, that would be great. Thank you. Oh, it's public. Fabulous. Yeah, it's public. So if you want your name changed or anything, please do change that now. Lovely. Okay, so I have had 2 pre-asked questions, so I'm going to make a start with those, but if you've got different questions, please do just pop them in the chat now and I will get through as many as I can. So the first question comes in off the back of Dr. Jessica Eccles' talk yesterday. So Dr. Eccles mentioned long fingers, arachnodactyly, which basically overlap when you put your index finger and thumb around your wrist. Can you explain more about this? My hands are small, but I can do this. Does that make sense? It does. So arachnodactyly is basically one of the key kind of body shape indicators we would look for in a Marfanoid body type. So that doesn't mean you've got Marfan syndrome, but it's the body type associated with Marfan's that does occasionally pop up in other hypermobility disorders. So arachnodactyly basically just means kind of long, thin fingers, basically. And the test for that would be if you can overlap your finger and thumb around your wrist. This, generally speaking, isn't dependent on like body weight or size. So either you can do it or you can't, pretty much. If you have a really, really low BMI, it maybe makes it a little bit easier, but generally speaking, it's just one of those indicators. It in and of itself is not like a standalone kind of diagnostic thing. It's just one of the indicators of a group of different body shape things that we sometimes find with hypermobility disorders. Now, Jess's research basically found a correlation between that and some other stuff. But Marfanoid body type, what we would typically see is that there are a range of different markers, one of which is that, and another one would be something like having your arm span when you go from fingertip to fingertip be longer than your height, as an example. So I have that one, but I don't have any of the others. So at present, that's all it means, really. Research is ongoing as to whether it's an indicator of anything else. Stay tuned for updates from Jess on that one. The second question was, I seem to get shin splints very easily. Is this anything to do with hypermobility or just a me thing? Is there anything I can do to prevent it? Okay, so shin splints are a really common kind of impact-based injury. Sorry, I'm aware this desk is really wobbly. Give me a second. It's irritating me, so it must be irritating everyone else. It's a really, really common sort of injury you get mostly from like high impact activities. So as an example, walking long distances does it for me, particularly walking uphill. Any kind of like hill walking, every time I do it, I get shin splints. Likewise, running on pavements for a lot of people who do it. It is quite common in people, not necessarily who do high impact activities, but who have the sorts of bodies that don't handle impact very well. So for people who are hypermobile, who maybe have poor body awareness, unstable ankles, unstable knees, and low muscle tone in their legs, what you may find is that you are more predisposed to shin splints as an injury as a result of simply existing. So basically, it can, in theory, be a hypermobility thing, but it isn't necessarily going to be something that all hypermobile people get. It's just one of those injuries that you're going to be slightly more predisposed to because of the hypermobility. So in terms of prevention, what we can look at are things like absorbing shock more effectively. So shoes that are really well cushioned, have like gel insoles, or are designed to absorb impact effectively, are going to be really, really good. You can also have a look at general leg function. So things like if you've seen a podiatrist, if you haven't seen a podiatrist, maybe consider seeing one. A lot of the kind of leg, lower body type injury things, one of the things we can look at is actually like your foot and ankle positioning. Are you in a good position to start walking? If not, are you kind of fit enough to deal with that activity kind of thing? So actually, if you are finding that this is a recurrent problem, something like seeing a physiotherapist to build up stability in your ankles and seeing a podiatrist to get yourself some insoles might be a good combination of approaches to hopefully reduce this in the future. In terms of managing it short term, ice can be really effective for pain management, and actually compression sleeves or knee-high compression socks, a lot of people find quite useful in managing the instability that might be contributing to this as an injury, if that makes a little bit of sense. I hope it does. Okay, so those are my pre-asked questions. If those were your questions or you're interested in those things, please feel free to put follow-up questions in the chat, and I will try to basically find that. Okay, do we have any other questions? Oh, we don't. We are questionless this evening. Let me have a little scroll down. No questions at all. Okie dokie. So what I'm going to do, just until we get questions, is have a little ramble about seasonal coping strategies. So one of the things that I think maybe doesn't get enough attention in the healthcare realms is the fact that a lot of the variables that cause flare-ups or might impact our symptoms can be quite seasonally changeable. So as an example, an awful lot of people with POTS or with some other form of autonomic dysfunction find summer heat really, really difficult. The flip side of that is that often the same group of people and other groups find that cold weather is problematic, but in different ways. So things like if you are, generally speaking, you might find that secondary Raynaud's is a problem. So Raynaud's syndrome or Raynaud's phenomenon is where basically your body thinks that you're like hypothermic and dying on a mountainside somewhere, when actually you're just in the chiller aisle of Sainsbury's. So the blood vessels in your fingertips and your peripheral areas, sometimes in your feet or in your like extremities, like the end of your nose or your ears, basically clamp down. And it leads to kind of blanching and really, really cold to the touch feeling in those areas. What many people find is that when they warm up from a Raynaud's episode, you get a lot of burning pain as a result of your kind of body temperature and your circulation going back to normal. Now, this is much more common in people who have got autonomic dysfunction, like POTS, as an example. So if you are the sort of person whose body doesn't deal well with things like, temperature change, you may find that this is the start of you having some issues with your circulation going forward. So one of the things I recommend on a regular basis are compression gloves. So compression gloves are aimed at basically creating low-level support across your hands, and also encouraging your body to retain warmth in those areas. And these can be really useful for managing hypermobility type pain, but also for reducing the, reducing kind of aches and pains, and for improving that circulation. So a lot of compression gloves do come with the fingertips cut out. So that allows you to still do things like use touchscreens and, arts and crafts as an example, or typing, holding pens, all that kind of stuff. Compression gloves come in all kinds of different like colors and brands. Personally, I think Chronically Colourful amazing. The owner of them makes like tie-dyed compression gloves and they're fabulous. But any kind of compression glove is going to be really useful at retaining warmth through your hands. Likewise, things like wool wrist warmers, merino wrist warmers, are a really good way to keep that warmth in your hands, even if you're allowing the rest of your body to stay a little bit cooler. A common side effect of Raynaud's is often chilblains. So particularly for anyone who's taking a beta blocker to manage POTS, because beta blockers are exactly the medication opposite to what is typically used to treat Raynaud's. So being on something like propranolol, as an example, will make your Raynaud's worse. If your circulation repeatedly cuts itself off and then restores itself on a rapidly changing temperature basis, you become more vulnerable to chilblains. And for some people, these are really, really itchy little bumps. For some people, they might get kind of ulceration or kind of blistery bits that are just really painful. Swelling in your fingers is also pretty common as a result of that. One of the things that I've found in my long-running battle with chilblains every winter is that Tiger Balm is absolutely amazing for managing the pain, the itching, the poor circulation. It's a really good warming kind of feeling. So if, like me, you struggle with chilblains and this is the start of cold hand season for all of us, maybe consider checking out some Tiger Balm stuff as well. Okay. What's the difference between secondary Raynaud's and ordinary Raynaud's? So primary Raynaud's is a standalone diagnosis in its own right, as in you don't have a condition that predisposes you to, any kind of neurovascular type problem. It just is an existing problem in and of itself. A lot of people with primary Raynaud's will have it quite severely from quite a young age. Secondary Raynaud's is a similar condition. It does the same things, the symptoms are the same, but it's caused by a pre-existing condition. So in my case, my body overreacts to any kind of postural change and any kind of temperature change. And then the medication I use to take that counteracts the responses my body should have to warm back up. So basically, like, my circulation shuts down in peripheral areas. So it's the same condition effectively. It's just whether you've got it as a standalone thing in its own right, or whether you've got it as a direct result of some kind of wonky neurovascular type issue. Either way, management is pretty similar. Generally speaking, it will be conservative management to start with. So things like wearing gloves, things like avoiding picking up frozen food directly, avoiding strong changes in temperature, making sure you're moisturizing and maintaining kind of movement in your hands on a regular basis. If those things aren't working, medication is normally the next port of call. There is some vague indication evidence type stuff that eating pineapple on a regular basis can help because of the bromelain enzymes that are in pineapple. It's a good excuse for a pina colada, if nothing else. But yeah, so it's pretty similar, basically. A lot of people with primary Raynaud's will find that it is a bit worse, whereas secondary Raynaud's can just be like a mild annoyance when you're eating ice cream, but fine the rest of the time. That said, there is going to be some overlap in terms of severity across the spectrum. So lovely. Okay. Whoop. Oh, chat's doing that weird jump around thing now. Link Fairy has a seasonal virus and has become run down. Oh no, cold and sore throat. Bunch of mouth ulcers and very sore membranes. Any advice on foods that you wouldn't normally think to mash that might make eating easier? Okay. Banana is my go-to favorite mashed thing. I think it's great. Pretty much anything, if you stew it long enough, becomes a soft food. That said, things that are very high in acid, so a lot of fruits like stewed apple, as an example, might be a little bit on the stingy side. Don't forget, like, random little tips. So things like teething gels or like Bonjela aimed at kind of teething babies work equally well for mouth ulcers. And then like the Corsadil, is it Corsadil? Something like that. Kind of medicated mouth washes as well, just to kind of promote healing and prevent infections there. In terms of soft foods in general, I'm a huge soup fan. I love soup so much. If you are feeling that you're struggling kind of nutrient-wise, like tomato soup, but crumble up a stock cube in it, is a really good way to make sure you're getting a range of nutrients, but also a range of electrolytes in there, and it adds a little bit of salt in without it feeling too salty. So stock cubes as a drink, again, work quite nicely as a way to get electrolytes in and a bit of flavour, but without it being too difficult to eat. So hopefully some of that. formally recommending ice cream as a healthcare professional, I can do that. So ice cream, maybe see how that goes, but wear gloves if you're going to be picking up ice cream. Yes, they are. The compression gloves advertised for arthritis are exactly the same thing. Yeah, if it's a compression glove, it's a compression glove. They all get advertised for kind of various different reasons. Oh, the chat is really not working well today. Okay. What is occurring right now? Okay. My podiatrist has made full-size insoles to help relieve my sesamoiditis. Is sesamoiditis a typical symptom of heads/EBS, or more an arthritis thing? I have osteoarthritis too. Any thoughts on relieving it would be most welcome. I think that podiatrist is going to be the person to speak to that. Basically, from a hypermobility perspective, hypermobility predisposes you to any kind of musculoskeletal damage that occurs with like repetitive motions or prolonged hard work. So all of the kind of wear and tear injuries, all of the inflammations and itises, you can pretty much guarantee that your hypermobility is not doing you any favors in that regard. That said, it's not something I've come across on a very regular basis, certainly with people I've worked with and with my own family. So I wouldn't have said it was a typical thing. I think possibly it is more linked to the osteoarthritis, but then osteoarthritis is also linked to hypermobility. So sometimes it's not even worth trying to unpick which of the things is causing which of the other things. You just focus on your inflammation type thing. So pretty much anything with itis on the end of it, what we're looking at is inflammation there. So a lot of the treatment goes along the same routes, and it's often things like anti-inflammatories, ice, rest. Mobility aids might be a useful thing if you're finding, movement difficult at this point, and elevation. So putting your feet up as often as you can is quite a useful thing. If you have a little break, take off compressive things like braces, compressive clothing, and just get your circulation going a little bit as well, because improved circulation is, generally speaking, associated with better recovery from soft tissue damage. So I hope that's helpful, but fingers crossed your podiatrist can do some useful stuff for that. Lovely. Any advice on hand strengthening exercises for very hypermobile hands and or wrist splint? So strengthening exercises, I'm a big believer that the best exercises are functional ones. So doing things with your hands is going to be the most useful way to get better at doing things with your hands. An awful lot of arts and crafts activities are actually really excellent in terms of hand therapy. So things like knitting, crochet, all work on kind of fine motor control in a paced manner. Of course, we love the pacing. Anything like Fimo clay, anything with Play-Doh, anything that's like soft and squishy that you're kind of putting pressure through, all of that is going to be doing your hand therapy type exercises really well. My other advice is mostly around pacing existing exercises. So if you have any exercises that you do on a regular basis, try to think about, rather than doing like a block of exercise, do them in little bits throughout the day. So as an example, if you've made a cup of tea and you're waiting for your tea to cool down while you watch TV, a few exercises then, perfect timing. If you are sat on the loo and you can fit in 3 or 4 reps of whatever hand exercise you've got, do it then. If you're a passenger in a car, fit a few in there. If you are, I don't know, having a shower and you're waiting for your conditioner to work its magic on your hair, while you're doing that, few exercises in the shower, and then carry on with the rest of your self-care stuff. So trying to integrate exercises into your day are going to be a really sensible thing as well. The other thing I really like for hand therapy exercises are scrunchies. So let me just steal one from my hair so I can demonstrate. So I pretty much always have a scrunchie with me, even if it's not in my hair, it will be on my person. So exercises, as an example, like that, are a really good way to build up some of the supporting ligaments around the backs of your hands and strengthen your fingers. But what you're looking to do is to definitely make sure you're not hyperextending any of these joints. And if you can feel any kind of sharp, aggravating pain in your hands, it's often a good indication that this scrunchie is too strong for you and you need a less resistancy scrunchie. So find something that's maybe a little bit more worn out or a little bit thinner and a bit stretchier and try again. Likewise, that kind of exercise as well is a good way to start building strength in different areas. Often with wrist exercises, an easiest thing to do is to get like a tin of beans or something. So having your wrist supported on like a, arm of a chair, holding your tin of beans and then just dropping your wrist down and back up. Like that, very gradually. But also start working at little angles because it's a good way to really, really tune in to all of those kind of fine motor control type areas. So what you're looking to do is to, rather than just getting one or two muscle groups in opposite directions to be really strong, you're looking for all of the little kind of postural adaptation muscles to all get a little bit of a workout. So doing things at slightly different angles, but doing the same exercise is a really, really good one. That will hopefully help with that. In terms of wrist splints, I always, generally speaking, for any braces, recommend seeing an orthotist on the NHS. And the reason for that is if you buy braces yourself and they end up being useless, you're out of pocket. If the NHS buys you braces that are useless, they'll just buy you a new set. It's very, very difficult sometimes to find exactly the right fit, and you may find you get a wrist brace that's fantastic right up until you try to use it with a walking stick and then it becomes useless. Likewise, a lot of the really, really good splints can be really very expensive. So for a decent, what I would consider to be a decent wrist brace, you're looking at a minimum of £45. Anything less than that is either going to be not great fit-wise, not adaptable enough, or made of a material that's either really sweaty or not designed to last. So generally speaking, I would recommend seeing an orthotist. That said, there are a couple of braces that I do really like. One of them is the ManuMed Active from Medi. And I like this because it's a very nice breathable material. It's not beige. You can have adjustable tension, and the little plastic stay that offers some immobilization is removable. So you can use it as a step down brace where you've just got a bit of compression and a bit of like wrap around your wrist, but without the plastic bit, as you gradually start to improve your mobility and improve your strength kind of thing. And then if you do end up with an injury in the future, you can put the plastic bit back in for a little bit more kind of restricted movement. So that's one of my favorite ones. I've had mine for a very long time. They have lasted very, very well, despite the fact I've used them like in combination with my wheelchair regularly. They've been through the wash and come out fine. So those are some of the ones I do recommend quite regularly. The other company I'm in love with for braces would be Push Brace. Very expensive compared to a lot of the other companies, but they're a really, really nice lightweight material that survives the wash very well, isn't too sweaty, and again, is not beige. So have a little look through those. If you absolutely cannot access an orthotist, please feel free to drop me an email if you'd like further information there, and we can do appointments and actually have like a one-to-one conversation. Lovely. Ooh, let's have a little flick through. Any good tips for relaxing the sitting positions for lounging on a sofa to look at an iPad or TV or book or phone without slouching too much or being too tiring? I'm a curler up person. I find sitting at right angles to be completely exhausting. And I know a lot of people do the same. So actually just getting your feet up can be really, really useful. So experiment with footrests at different heights and different levels of support there to try and get you into a better position. If you're trying to avoid like hunching your shoulders forward, the easiest thing to do is to bring the thing that you're trying to look at up a little bit. So if you're doing computer work as an example and your computer is below eye level, what you'll find is that you start working like this and you gradually hunch over more and more. And you end up with that kind of awful like back of the neck tension pain. Whereas if what you're looking at is up nice and high, you can keep your shoulders back and your head in a nice neutral straight position and you can still see what you're doing. Book rests are a really, really nice thing to try. So I think mine's called the book seat, maybe book seat. Basically, it's kind of a bean bag, but like a triangle shape. And then a book rests in it behind like a little plastic perspex bit. Because it's made of beanbag, it's really, really, really good at coping with uneven surfaces. So if I'm laying on the sofa, I will prop it on my chest with my book facing at my face, as an example. Or if I'm reading, I might wedge it next to me whilst sat down. And because of the beanbag nature of it, it will cope with the fact that it's not on like a table or anything. Whereas a lot of the tripod book rests don't really cope well with sofa-based activities. So that can be quite a good thing to do. You may also find things like music stands are quite useful because you can just have it next to the sofa and prop whatever you're looking at up rather than kind of trying to look down onto whatever it is you're doing. If you are, let me just reread that question. Yeah, I think those are the, get the equipment in the right place. The other thing you can have a look at is your actual sitting position. So one of the things we can do to really increase sitting stability is to add a bucket seat. So you may have seen this particularly on like sport wheelchairs, like wheelchair basketball or wheelchair rugby or any of the kind of sports like that. What you see is for people with spinal cord injuries, if we raise the knee end higher than the hip end, so that basically your legs slope upwards and then go down at the knee. What that does is increase stability around the core area. So you kind of sit back into the seat, which is particularly useful if you've got hip, lower back, pelvic, or kind of abdominal problems, weaknesses, instabilities kind of thing. So what you may find is that you are better at tolerating being upright if your knees are a little bit higher. And if that's the case, what you can do is get yourself a wedge cushion, which basically is a cushion that is like 3 to 4 inches at one end, but tapers down to a point like a long, thin triangle. And you put the pointy end at your butt end and the raised triangle bit at your knee end. So it will just kind of tip you back in and bring your knees up a little bit. And you may find that's a really good way to increase that sitting tolerance and decrease that instability. Decrease instability, increase stability. That combined with, having your book rest up nice and high means you're probably going to be able to kind of sit upright a little bit better. That said, the best improvement for all of these things is building muscle. So if you're not already seeing a physiotherapist, I would strongly suggest seeing one. You can also check out the amazing Jeannie de Bon and her Zebra Club app. Even if you don't buy the Zebra Club app, Jeannie de Bon's social media is filled with absolutely amazing tutorials in great detail about how you can improve your kind of muscles, your functioning, your sitting tolerance, your posture, all of the other stuff. So yeah, start stalking Jeannie de Bon online and get yourself like wedge cushions and things as well and see how that goes. Yeah, hopefully that's useful. Lovely. Looking at buying a new sofa. Very excited. Oh, stop skipping around. Sorry, I don't know what's up with the chat today. This is really annoying. Very excited by charging plates and drink coolers, built-in craft lights for real, and so on. Making sure there's neck support. Anything else we should consider? Oh yeah, actually, yeah, neck support on a sofa is a really interesting point. Quite a lot of people will have like a formal diagnosis of craniocervical instability, which is where we're looking at your neck and going, yeah, it's really squishy and wobbly, and we're not pleased about that. That said, if you are a hypermobile person who's hypermobile everywhere, common sense dictates that you're going to have a hypermobile neck as well. So I kind of just, until proven otherwise, assume that all hypermobile people have some degree of cervical instability. In line with that, it can sometimes be very useful to have like U-shaped travel pillows. So you can either have them behind your neck so you've got something to prop your head up on, or you can use your U-shaped travel pillow backwards so you've got something to rest your chin on. And it works kind of like those soft collar neck braces, but without restricting your range of motion quite so much and without you getting Velcro stuck in your hair. So travel pillows might be a good thing to do, particularly anything made of like memory foam that's going to give you a little bit of kind of contoured support while you're using it. Lovely. I'm raising my knees above my hips when sitting at work for years and fighting with works. Oh, I don't understand how anyone finds sitting at 90 degrees to be comfortable. I just don't. It baffles me entirely. The other aspect of that you may find is relevant is so hypermobile people are quite prone to have like a lumbar lordosis, functional lordosis. So what that basically means is that through a combination of abdominal weakness and instability of the spine, we're more prone to having quite a deep arch at the back. So if you think of the position that Instagram influencers use to make their butts look great and their waists look tiny, that like archy back thing from behind, basically having a sticky out butt is a hypermobility issue. It's a really kind of classic hypermobile pose type shape. So if you are living like this, what it can do is cause back pain. And the way that we correct that is by changing the angle of your pelvis. And the easiest way to do that is to bring your knees up. So if you have lumbar lordosis, sitting at 90 degrees, you're hyperextending your back. If you tilt your pelvis a little bit and bring your knees up, it corrects that lordosis and brings you back into a nice neutral pelvic alignment, which tends to relieve pain. So please feel free to tell the work people that think you have to sit at 90 degrees that occupational therapist Jo says you don't have to keep putting your knees up. Yeah, hopefully that helps. Lovely. Oh, we caught up. Thank you, Link Fairy. Lots of good stuff in there. Okie dokie. Any more questions? Or any like vague areas people are interested in, even if it hasn't formed its way into a question yet? Let me get my caffeine fixing. Right. Speaking about lordosis, actually, it does kind of make me think about the hypermobility aspect where hypermobile people often cheat exercise. So what we'll see is, to the untrained observer, at a glance, most of us will look a lot more functional than we actually are. So can I walk from one side of the room to the other? Yes, for the most part. Can I do it using all of the correct muscle groups in the way that they're meant to be used without any kind of micro injury occurring? Very rarely. So what happens is we'll look like we're doing the right thing, but we're actually using a series of completely unconscious but very complicated adaptive strategies to compensate for the fact that various bits of our anatomy are a bit squishier or a bit stiffer or a bit like less useful than they should be. So what can happen here is that when you see a physiotherapist or you start doing exercise, particularly things like Pilates or yoga, you look as if you're doing really, really well. And then you end up with a really horrendous pain flare up because it turns out you actually weren't ready for that level of challenge in any way, shape, or form, but you've cheated your way through the lesson by accident and actually accumulated quite a lot of damage in the process. So what tends to happen because of this is that particularly when you see a new physiotherapist or you start working with a new gym instructor, they'll go, how does that feel when you're doing 3 reps of something? And you go, yeah, it feels all right. Forgetting the fact that most of the time you don't get an immediate cause and effect pain flare up. Most of the time what happens is it feels fine at the time and the next day it feels like you've been run over by a bus, right? So you'll do it a few times and they go, how does that feel? And you go, yeah, it's all right. So then they give you a slightly harder exercise and say, go home and do that 10 times, 10 times in a row, 3 times a day. And you go, okay, I'll go and do that. But actually that's a completely unreasonable amount of exercise. And that's way too difficult and just too much and too intense for the hypermobile body. But we don't recognize these things until too late. So really working to improve your body awareness can be a very useful thing in terms of symptom management, because you start to recognize when you're like twisting your legs a little bit or rolling an ankle a tiny bit, or when you're using the wrong muscle groups to do things and it's getting a little bit tight or a bit twingy, or your shoulders feel a bit weird. All those little signs that we so easily ignore. If you start tuning into those, you can avoid some of those really horrendous pain flare-ups, or at least diminish the severity a little bit by being increasingly body aware. Likewise, if you are starting a new routine or a new exercise or a new sport or a new hobby, go in very, very slowly. So if I'm talking to patients, normally if they say they're starting work with a new physio, I'll say, how much experience of hypermobility does this physio have? And they say, not very much. My response is always the same. And my response is always, do a third of what they recommend at a third of the intensity. So scale it way, way back and build up over a minimum of 2 weeks. If at the 2-week point you still haven't built up to the point where you can actually do any of those exercises without a pain flare up, go back and say it's way too hard. Because I think that cheat exercising thing makes it very, very difficult for all of us to do these exercises without causing some kind of ridiculous flare up, because we just don't know what our own bodies are actually capable of, because poor proprioception. So in terms of coping strategies, things like compression clothing can be really, really useful. Things like kinesiology tape can also be very useful if your skin tolerates the adhesive. Always, always, always apply like a couple of hours before you do physical activity, so it's well adhered before you start, and always soak it off. If you can't physically get in a bath, get like a wet flannel or a wet towel and lay it over the tape for like 2 hours, refreshing regularly before you attempt to peel it off, or you are going to lose a bit of skin. But yeah, so I think kinesiology tape, there's some really interesting research around that, because basically the evidence base in general for kinesiology tape says it shouldn't work as well as it actually does. But for hypermobile people, one thing that it is proven to do is increase proprioception. So proprioception is your body's understanding of where you are in relation to yourself, but also your environment. And if we can improve proprioception, we can avoid all those situations where we clash with our own environments, often painfully. As an example, every time I ask a hypermobile person this, they say yes. Every time I ask a non-hypermobile person this question, they look at me like they don't really understand what this thought process even is. Have you ever walked through a door and got the door handle down your dressing gown sleeve as you go through? Almost every hypermobile person I work with says yes. But that kind of thing is partly because of poor proprioception. So if you find that you are the sort of person who just bounces off furniture constantly throughout the day, compression clothing is a really, really good thing to try, as is kinesiology tape for things like your feet and your knees. So I do actually have an introductory post for kinesiology tape on my website. It's jboccupationaltherapy.co.uk/kinesiology-tape, if you don't mind, link fairy. It is also within that, there is a link to a Pinterest board I've compiled, and the Pinterest board has tutorials for as many body parts and as many different injuries as I could find at the time. So hopefully that will give you a starting point. Most physiotherapists have some experience with taping. You can ask them to teach you how to do it for specific injuries. So if you're seeing a physio, you know, while you're there, would you mind just taping this up so I can try it and show me how to do it? A lot of the major suppliers of kinesiology tape, so like KT, what are some of the posh ones? KT, brain blank. Basically, if you Google kinesiology tape tutorials, if you can find a website that stocks it and they've got links to tutorials on their YouTube channels, and the YouTube channel videos are done by a physiotherapist or a member of the tape staff team, generally speaking, that's a good thing to try. What you're looking to do is basically replace your ligaments, but on the outside with tape. So if you can't find a tutorial for a specific thing, specific injury or instability or whatever, you can often bodge it based on anatomy diagrams of where the ligaments are. So as an example, if I know I've got a weakness here, what I would be looking to do is to cover this area with tape, and I would start a bit further in, no stretch, about 50% maximum stretch for like the duration of that ligament, and then no stretch for kind of the end bit of tape, so you've got an anchor either side. So anatomy diagrams can be really, really, really useful for this, because it basically just use it as a framework for working out which bits of you are rubbish and how you can cover them up. Yeah, hopefully that's useful. Just scroll down again because the chat's gone weird. Oh, this is really annoying. Rock tape, that's the one. Thank you. Yeah, rock tape have some really great tutorials. Also, some very cool patterns. Read tape, REA tape as well, have been pretty good in the past. And D3 is the other one. Thank you. Saying rock tape just unlocked that portion of my brain there. Yeah, thank you. Excellent. Yeah, so that kind of thing can be quite useful. One thing I would say is that if you're doing tape on yourself, take photos of different versions of it. And when you get to the point where you feel like you've created the perfect tape of yourself, make yourself a tutorial of it so that you can replicate it next time without brain fog, deleting that information from your memory. So yeah, I would say, like, I've basically, particularly for like shoulders and hip issues and ankle issues, I've got like a little stash of photos on my phone of like things that I've done regularly that have worked well. Often it will be a combination of 1 or 2 different tutorials tweaked for my specific anatomy. But yeah, one of the things I would say was just see a physiotherapist about that and see if they can replicate it. If you find that kinesiology tape is particularly useful and compression clothing are particularly useful, your option then becomes, what can I do that's a combination of those 2 things but doesn't involve peeling my skin off? So there are a couple of brands out there that make custom-made compression garments. So custom-made Lycra compression garments. Let me just roll this backwards so you can actually see. I'm not covering my whole face, sorry. Ooh. Okay. So, sorry, that's really wobbly. This is an old pair of shorts that I had made many, many, many years ago. So the dark blue is a single layer of Lycra. Okay. The light blue shows layers where they've added extra reinforcement to increase stability. So for me, a lot of that goes around the back of the butt to increase like sacroiliac stability, and the side of the hip to stop that kind of hip dropping out sideways motion. Now, what I really like about compression clothing like this is that it's custom made. So it's designed specifically to fit your exact body. The other thing I really like is that they can build in zips. There's nothing worse than wriggling yourself into a pair of compression clothes that work wonderfully for your hip and knee pain, but dislocate your thumbs every time you have to pee. So compression clothing like this does sort of solve a purpose, basically, particularly for hypermobile people with POTS, because you can get like a full-length legging that's also basically working as full-length compression. So that combination of compression but also reinforcement can start to encourage your body to reset to a nice neutral position. There are 3 companies in the UK currently making something similar. The first is DM Orthotics, the second is Jobskin, and the third is Allard UK. Allard have 2 versions. They have the completely bespoke option like this. And they also have a version that is basically designed to be a little bit more off the shelfy, a little bit less customizable, but specifically geared towards hypermobile people. I am on the waiting list to get one through my orthotist, so I will report back when I've actually had a chance to wander around in it, if it's any good. But all 3 of those companies do this on the NHS. So I would strongly suggest anyone who's interested, get yourself a referral from your GP or consultant to an NHS orthotist. and an orthotist will be able to, if not fit and measure you themselves, to summon a representative from whichever company your local authority has a contract with to fit you for these. Now, they typically only last like a year, or you'll need changing as your body shape or size changes, or your kind of compression needs change. The older it is, the less compressy it will be. This is now my demonstration only pair because it's probably a decade old at this point, and it's kind of gone a bit see-through in the middle as it gradually disintegrates. But you do get at least an idea of how these sorts of things work. So this, I think, is a really brilliant thing for a lot of hypermobile people, because what it does is give you a really wide range of support and a really flexible fit as well. A lot of braces are quite fixed, quite rigid, and they limit your range of motion quite a lot. This does not do that. So what it's doing is encouraging you to move more sensibly, but you can still push into all of the areas. So I used to wear these a lot when I was still doing gymnastics and rock climbing. They don't hamper your range of motion. They just encourage you to have a safe, sensible, normal range of motion rather than weird hypermobile range of motion. With any splint and brace, typically there's a risk of what we call deconditioning. So deconditioning is basically your body getting lazy in response to the brace doing all of the work. This is much, much more likely to happen with increasingly resistant braces. So the stronger the brace, the more restrictive the brace, the more likely you are to decondition. Because this isn't preventing you from doing anything and is in fact encouraging you to do things using the right muscle groups, your risk of deconditioning from something like this is negligible. Whereas wearing something like a caged or a hinged knee brace, a lot of the time, your risk of deconditioning is a bit higher. So generally speaking, I think these are a great option for a lot of people, particularly if you find that tape and or compression are useful for you, because this will save you from having to buy 10 miles of tape a month. And actually, from an NHS perspective, it's a really, really good, effective use of money, because it is going to be the sort of equipment that allows you to exercise, the sort of equipment that allows you to do a little bit more from a rehabilitative perspective, whilst minimizing injuries as well. So yeah, check those out. My wonderful link fairy has provided links to all of the things there. I think that's all the questions, isn't it? I'm running out of things to talk about. This is very, very quiet. I hope it's still been a useful one. Okay. Any questions, any topics, anything at all people have wanted more information about? Okay. I talked a little bit about temperature change in relation to circulation earlier. So another thing that tends to happen with changing seasons is our sleep cycles get increasingly wonky because daylight disappears again. Vitamin D deficiency is pretty common. It is affecting around 1 in 4 people in the UK. Okay. However, the threshold for what the UK considers to be deficient is much, much lower than a lot of mainland Europe. So if you were to take the cutoff point for deficiency in Spain and apply that to the UK population, a much higher percentage of us tick ourselves off as having vitamin D deficiency. So vitamin D deficiency can result in such unpleasant symptoms as muscle pain, which might sound familiar because probably all of us have it. So this is one of those examples of how we shouldn't be too quick to jump to ascribing every single symptom we have to a hypermobility related thing. If you have an increase in symptom severity, a change in your symptom presentation, or a new symptom pop up, always, always, always run that past a doctor at some point. So it very well may be that your muscle pain is purely because you're a hypermobile person who's chosen to exist for a little bit longer. It might be vitamin D deficiency. It might be that you injured yourself recently. It might be that the last massage you had was too intense, that kind of thing. But I think, speaking on behalf of all healthcare professionals, there isn't a single doctor out there who would rather you didn't go in with something that turned out to be serious versus being a revolving door patient a little bit and coming in with a never-ending series of things that turn out to be just hypermobility related. So what you may find is that your symptoms change a little bit across the seasons. Once you've got a handle on that and what that looks like, you can start to have a slightly more seasonal bucket of coping strategies. So as an example, your clothing choices might change, your splints and braces might change, your the times you take your medications might change because your sleep cycle changes. Your diet might change, so you need to factor more energy into cooking if you want warm food, as an example. So things like slow cookers can be an absolute game changer for making hot food in winter because it doesn't require you to stand up consistently for a whole block of cooking. It's the sort of thing you can do a little bit of and then wander away and never lay down and then do a little bit more. So seasonal coping strategies, what you can find is that like in spring and autumn, you struggle a little bit more because you have to go from like summer mode on one day to winter mode the next day. And sometimes you won't necessarily get that right. So my partner works nights. I got up in the morning, I got dressed in what I thought was an appropriate autumn outfit. And then 3 hours into my day when he was firmly asleep, it got really, really hot. And I suddenly found myself really quite potsy, like laid on the floor in my craft room, wondering why I couldn't function. And I couldn't function because I was wearing a jumper. So my new autumn coping strategy involved having a t-shirt in my office that I could change into if I overheat. So these kinds of things can be really, really useful when you're kind of building up a sort of what if toolkit. So your health toolkit is aimed at dealing with whatever it is your body, mind, or life chucks at you. If you are finding that there's just like a never-ending list of things that could possibly go wrong, having coping strategies in place for them before they go wrong is a really useful way to reduce the anxiety and the stress you may have about that potential outcome. So if I know I might overheat, well, okay, I've got a t-shirt I can change into now. I've got a drink I can have. I've got, somewhere I can lay down comfortably. If I didn't have those things, I would be much more likely to end up in some kind of flare up, feeling really unwell. And I might then be anxious about the fact that I might end up in a flare up. So seasonal coping strategies are a sensible thing to look into. Really, really consider which of your symptoms might be like seasonally reactive or might change as you go. And also consider, if you are particularly kind of brain foggy, having a partner who is aware, or a person or a friend or a GP or a parent or whoever. Have somebody who is aware of your coping strategies and can maybe remind you when you end up in a bit of a sticky situation and your brain kind of goes, don't know how to cope. And this is why personally I enjoy writing flare-up plans. So a flare-up plan is basically just a document that has all of this written on it. So in the event that you feel a non-specific kind of terrible, you check your flare-up plan for the matching symptom and then follow the instructions for the coping strategy on the other side of the page. Hopefully that's kind of useful. Okay, let me have a little look. New question. I've been given NHS crutches to replace my 2 sticks for hip subluxation and foot issues. Why are the handles so tilted up, which promote carpal tunnel stimulation? I find that I have to hold the end of the handle like a knob. I was thinking of inventing Nobby's crutches to suit a hypermobile pair of hands, but do they exist already that I'm not yet aware of due to my lack of experience in this area? I am quite convinced that standard NHS crutches are deliberately awful so you bring them back sooner. Genuinely, I believe this. There are so many pairs of crutches available out there that are just better than the standard handles. What you might like to have a look at would be Fisher Grip, Fischer, or ergonomic grip crutches, which are left and right hand specific. And what they have is a flat area where this bit of your palm rests, and then like a normal handle bit further down, so that you're resting some of your weight here rather than just across like the kind of middle bit of your palm there. So if you're distributing weight there, it can help. And what you can then do is when you're using them, bring your wrists round a little bit more, so you're wrapping around the crutch ever so slightly as a way to not have that kind of cock up, like wrist aggravating position. Another option, if you are particularly prone to wrist related problems, would be to look at gutter crutches. So gutter crutches are designed that the bit of your body that you're resting your weight through would be your forearm. So they work with a crutch upright stick and then like a flat bit on the top and then like a little handle that sticks out here. So you would then rest your forearm on the platform bit, strap your forearm in with Velcro, and then loosely hold around a handle. And what that does is completely remove any of the strain on your wrist. That said, it does drastically increase the amount of space your crutches take up. They're a little bit awkward if you're trying to like get to a cash point or pay at a checkout or carry a mug of tea or something because you're Velcroed into your crutches. A hybrid of those would be Smart Crutch. So Smart Crutches are aimed to distribute some of your weight through the back of your forearm, and they're angle adjustable from sort of right like that all the way up to flat. And what that does is give you a range of options depending on how you feel day to day. Again, they're a slightly more relaxed handle position and it's a slightly different shaped handle. The only slight issue I have with Smart Crutches is that compared to a similar crutch of the same size, they're a little bit heavier and a bit bulkier. They do have a petite version now, which is better, but they are still slightly on the heavier side. So if you have particularly low muscle tone or you yourself are quite kind of petite, percentage wise compared to your own body weight, it doesn't feel particularly fantastic. Cool crutches are a lot lighter weight and do have an ergonomic grip option. There are quite a lot of companies that do like a generic ergonomic grip crutch as well. So I would definitely have a look at those. Feel free to drop me an email. My contact details are in the thing if you would like to have an actual appointment about this. Your other option is a company called Remap, R-E-M-A-P. So Remap are basically a company who are filled with engineers and occupational therapists and physios and fabricators and all kinds of other people. And they basically just make things like what you're describing. So if you've thought of a product that would change your life, they'll make it. That's their job. They fabricate random bits of equipment for different scenarios that are like a niche scenario. So maybe have a look at Remap if you think that your new crutch idea is a game changer, because they might actually be able to make it for you. So yeah, it does sound like a more sensible position, to be honest. If you do make them, please drop me a link. Maybe I'll get myself a pair. But yeah, interesting. Very, very interesting. Okay. Oh yeah, Link Fairy. Excellent advice there. A lot of people, in terms of walking sticks, like trekking poles are a really useful option because you have your wrist kind of flat and your arms out in front of you at right angles. So they can be particularly useful for just giving you a little bit of like a pull, like Nordic walking style. And they're really great on uneven ground if you want something to improve your balance as well. So yeah, excellent advice. Okie dokie. I think that is everything. Magic Joe. I love that new nickname, getting it on a t-shirt. Lovely. I think that is all of the questions. Fabulous. Timed it perfectly. Okay. Thank you all very much for coming. Please do come back next month. Please don't come back next week. I won't be here. It's always the third Thursday of every month at 7 p.m. UK time. I will sometimes have special guests with me. So if there's anyone you would like to see, please do fill in the feedback form that my lovely Link Fairy has just dropped in the chat. And we can use this as ammunition to bully different healthcare professionals into joining me for 1 week. No, we won't actually bully them. We'll ask them nicely. It's all good. So if there's anything that you particularly like to see in future episodes, as it were, please do pop that on the feedback form, because it does help us kind of basically like guide how we're doing that. So yeah, thank you very much. And if there is anything else, no, definitely all done. Fabulous. We're all sorted. Thank you very much for coming, and see you next time. Take care. Bye.